Hello everyone. For those of you who don't know me, my name's Gaye and I'm the Pilbara McGrath breast care nurse. I'd like to thank the Breast Care Network Australia for coming. This is a great opportunity for us to learn from the professionals and to understand the support services that they give. And also like to thank the McGrath Foundation for being able to be here, for funding for this role, and for WACS to have the foresight to understand that there is a need for breast cancer help in the Pilbara, and we haven't realised what help is required until such time as this role has been started, and then we've started to get the referrals, which of course have been on an exponential increase since the words got out, and now we have the breast screen ban, and we get a lot of referrals from Metro because of this service, which is good because now we can look at patients, engage with them and try and help them through their journey. So my role, I'm just going to look at this if you don't mind. I have a 2-day week only, and this is now ongoing for the next 3 years. So this is set in concrete for the next 3 years, and it's important because I'm going to ask you to consider what you think is going to be important to better this role and to bring more services in. And in 3 years' time, you might want to consider that you could advocate for more time in a breast cancer nursing in Headland. It's up to you later on. I'm going to talk about that more. So with only having Thursday and Friday, it's busy, and I try to do as much as I can for everyone. I use the model of care because my experience in nursing is different to everybody else's experience and being a breast care nurse. So I was a palliative care and cancer support nurse. I was an educator for very many years in Wheatbelt, and that's where I did my palliative care and cancer support. I also started to do chemotherapy in Wheatbelt and then had to drop that, and I wanted to come up to the Pilbara because this became an opportunistic moment for me to become a breast cancer nurse, which now I'm engaged with cancer. And Bridie has this unbridled passion and drive to make things better, and she just makes me want to be better. And it's very exciting to be working alongside her because I've just been bumbling along for a little while and suddenly realising that we need to do a lot of work in Pilbara to make sure that you are supported. So yeah, so that's me basically. I love my breast cancer nursing. I also have a postgraduate diploma in counselling, which has helped me. So I've got a few things, but I don't have surgical, so I don't know anything about those surgical sides, except I just try and fake it and tell Bridie all sorts of things. So I manage the psychosocial side of things because I am one of the 2 most remote breast care nurses in Australia. A lot of it is the psychosocial barriers to treatment because of the tyranny of distance to getting really good treatment. Health literacy, financial, family, cultural, language, that's all part of what I do to get people through on their breast cancer experience. Care coordination, so I interact with specialists, medical oncologists, all kinds of people, the lymphedema service down in Royal Perth Hospital, you name it, I've been there and done that, had contact for a patient, advocated on their behalf. So I do private and public patients. Private's a little bit more tricky for me because I get no information, so I'm grilling you as you go, give me the information because I can't determine what's going on if I don't have that information. I do a lot of referrals. I'm constantly referring out to people because I can't provide everything to everyone all the time, which makes me anxious. However, there are amazing people out there like Breast Cancer Network Australia and Breast Care WA. And I do wellness. I try and engage into the wellness stream. We no longer call it survivorship piece, it's wellness, because we've talked about those journeys and you know, we are ongoing into wellness. So services available in Pilbara, so this is part of my brief. We have the Well Women's Centre in Headland. I get quite a few referrals from there. We have Reaches, which is a financial charity that allows patients or people with breast cancer to be funded to do certain things. This is unique to Western Australia, so we are extremely lucky to have these supports. Chemotherapy at Karratha Health Campus with Tracy, who's sitting up the back there in Bridie. They are an amazing team, scary, really, because they just advocate for the patient. You go, oh, okay, no worries, when you just do what they say. The Pilbara Cancer Care WA Liaison Officer is Monica Graham, so we have our own person who is a liaison with Cancer Care WA, the Cancer Council. And we have a cancer rehabilitation physiotherapist. I thought Hannah was here at one stage. So Hannah was here at one stage, and she she's a student, but she is a physiotherapist soon, and she will be focusing on cancer. So this has become a new body of work for physiotherapists in a specialty. We've got the Bra Bar and beautiful Janice. We've got Breast Screen WA every year here in Headland and Karratha. And we have Solaris Cancer Care and beautiful Eliza. Where is she? Oh, there you are. So Eliza is there from Solaris Cancer Care, and she's linked in with the Pilbara, so we're actually very lucky to have all these links. We've got the next one. Okay, so one of my briefs was to highlight what we have with regards to diagnostics in here in Pilbara, and bottom line is we don't have any apart from ultrasound. Now I want it to be very clear that you could be advocates for the people that you might meet that have a breast lump and get an ultrasound here, and they may diagnose it as something suspicious, but every single person who has a suspicious lump needs to go to Perth. And that's, do not wait, make sure you get to your GP to refer you, you follow up on that. When is that going to happen? How come they've decided that I have to wait 3 weeks instead of 2 weeks? What is going on? Because the investigation of a new symptom must be done by a GP, and we're going to talk to health professionals tonight with regards to, they have a flow chart in which to follow, and that comes from the Australian Government Cancer Australia, and every GP should know about that, and it's like within 2 weeks you need to do this, and within 2 weeks you need to do that. They may send somebody to have an ultrasound in Pilbara, but if that ultrasound is suspicious, people need to go to Perth. They either go through the public system or the private system. If you go through the private system, you go to a breast clinic. If you go to a public system, you go to a breast clinic. There are specialist breast people there that will put their hands on you, do the triple testing, fine needle aspiration, mammogram, 3D mammograms. We can't do them up here. So that's one of the things I want everyone to understand, that this is a body of work that we are going to work on to make sure that every woman in Pilbara has the same level of care from diagnosis. Oh, thank you. Okay, so what I would like you to do is, because you're going to get an evaluation, could you please write down what your wish list is for our service to be in Pilbara? We have no idea, and we need to get consumer engagement and feedback. So, one of the things that came up was that you have some concerns, and this was in the preamble to coming here. You were given the opportunity to put some things down. Financial is a big impost for people, and we do recommend that the Cancer Council WA through Monica Graham, she can assist with financials. We have reaches, the Breast Care Network Australia and the Breast Cancer Network Australia and Breast Care WA all going to provide financials. This is a tricky one, and we need to have more of an expander on what you really need with regards to finance and where you're really missing out. Emotional support. So we've got all of these up here. Your GP can give you a mental health plan. We've got the BCNA and the BCWA, and then generally people can ring me if they need support, and I can then refer if you don't feel up to doing it yourself. Accommodation is at Crawford Lodge, Milroy Lodge, PATS approved accommodation. There is that if people aren't aware. Travel assistance is PATS, and Reaches can provide extra assistance if you engage with them and negotiate that, such as if you go down there with PATS but you need to go between multiple appointments, then they will, you're going to know my brain.
I know, I was listening too. I was like, she's nearly there.
Reaches actually can, and have in the past provided, for a hire car. They do amazing things. And long-term support, the King Edward Menopause Clinic, I can refer you. You don't have to wait for the doctor to refer you to that. I can refer you to that. And Breast Care WA. So those were some of the things that came down as to some of your concerns. Please let us know what you would like. I'm going to tell you what my wish list is. Right? My wish list is for our, so I'm just going to swear, a great big pink car with culturally sensitive Aboriginal design saying breast cancer nurse. So I can hoon around the whole of Pilbara because it's difficult getting a car, and I wanted to advertise everything, and I want to be able to go and drop everything and run and see my patient. Now that's my fave. Then for Bridie and I, we need admin support because a lot of our time is spent putting it down on paper so that we can show that we actually have all of this stuff happening. We're actually seeing patients, the time that we see patients. We don't have time for that, not on 2 days for me, and it's a big part of your job too, isn't it? You have to evidence everything and write it all down and cover our derrieres, with our notes and things. And I want a breast care nurse at Headland because there are a lot of ladies missing out from me being able to bring my car over and see them. So I think that's really important into the future, but we have to evidence it. And that's from me. Thank you.